Chagas disease, also known as American trypanosomiasis, is a tropical parasitic disease caused by the Trypanosoma cruzi parasite, which is primarily transmitted through the feces of the triatamine bug, known colloquially as the kissing bug. The initial symptoms can be deceptively mild, including fever, fatigue, body aches, headache, and rash, but its notoriousness lies in the chronic phase, which can lead to severe cardiac and digestive problems years after the infection. As the disease progresses, it can cause enlargement of the ventricles in the heart, leading to heart failure, or enlarge parts of the digestive tract, which can cause severe constipation or difficulty swallowing. Treatment for Chagas disease is most effective when given early and typically includes antiparasitic medications such as benznidazole or nifurtimox. Individuals at higher risk for contracting the disease are those living in poorly constructed homes in Latin America, where the triatamine bug can easily hide and spread the infection. With concern for this silent yet progressive illness growing, here's a detailed look into the various aspects of Chagas disease. Symptoms and progression of Chagas disease. Chagas disease, a tropical parasitic illness caused by the protozoan Trypanosoma cruzi, initially presents with symptoms that are often mild or absent, such as fever, fatigue, body aches, and swelling at the infection site. However, as the disease progresses, it can result in severe chronic conditions, notably affecting cardiac and gastrointestinal systems. Cardiomyopathy can become life-threatening, leading to heart rhythm abnormalities and potentially sudden death. In the digestive system, enlargement of the esophagus or colon can disrupt the normal food and waste flow, causing dysphagia or severe constipation. Understanding these symptoms is crucial for early detection and management, as the chronic phase can surface decades after initial infection, often when irreparable organ damage has occurred. Diagnosis of Chagas disease. Chagas disease, caused by the protozoan parasite Trypanosoma cruzi, presents a diagnostic challenge due to its variable symptoms and phases. Acute Chagas is often missed due to nonspecific symptoms resembling other illnesses. If untreated, the disease can enter a chronic phase, which can be asymptomatic for years until severe cardiac or digestive issues emerge. Diagnosis typically involves serological tests to detect antibodies against T. cruzi, with additional confirmation through PCR methods that amplify parasite DNA, providing a more sensitive detection in the chronic phase. Accurate diagnosis is crucial for early intervention and prevention of the disease's progression to its life-threatening stages. Cause and risk factor of Chagas disease. Chagas disease, triggered by the protozoan parasite Trypanosoma cruzi, primarily spreads through contact with feces of triatamine bugs, often called kissing bugs. These insects feed on blood and defecate near the wound. The parasites enter when the bite is scratched. Risk factors extend beyond bug bites to include blood transfusions, organ transplants from infected donors, congenital transmission from mother to child, and consumption of contaminated food or drink. Rural areas in Latin America bear the highest risk, where poverty, substandard housing, and living in close proximity to the triatamine habitat increase the possibility of infection. Climate change and migration can alter the geographic distribution of the disease, posing new public health challenges. Treatment and management of Chagas disease. Treating and managing Chagas disease, a parasitic illness caused by Trypanosoma cruzi, involves a two-pronged approach: antiparasitic treatment to kill the parasite and symptomatic treatment to address complications. Antiparasitic therapy with benznidazole or nifurtimox is most effective during the acute phase, but can be useful in chronic cases for children or adults without advanced Chagas cardiomyopathy. Managing complications such as heart rhythm abnormalities may require medications, pacemakers, or even heart transplants in severe cases. Vector control, screening of blood donations, and improving housing conditions in endemic areas are critical in preventing the spread of the disease. Ongoing research and development of new treatments are vital, as current medications have significant side effects and are not universally effective, particularly in the chronic phase.